Data shows at least 30 million people struggle with eating disorders in the U.S., and disordered eating is becoming more and more common among adults.
Our Mary Stackhouse talked to a local counselor to find out more about why many adults struggle with it and what can be done to help.
It's not just a struggle for teens.
We're seeing an increase in older adults, especially women above age 50.
Lauren Roberts is talking about eating disorders as more adults are struggling with disordered eating, often silently.
A lot of times, because it is ascribed to teens only, there's that stigma placed on it that prevents adults from getting help. They believe that it is just a teen affliction when it is affecting so many adults.
According to the National Association of Anorexia Nervosa and Associated Disorders, 13% of women older than age 50 engage in some kind of disordered eating behavior. Roberts, who works with people of all ages who struggle with eating disorders, says life stressors often cause them in older adults.
Divorce, becoming a grandparent, your body changing and fat distributing differently among your body. And all of these stressors create more fear about weight gain and more wanting to control how you are gaining weight.
Roberts says some of the most common types of eating disorders she sees in adults is binge eating and calorie restriction.
What's most important is awareness among adults. First, we've got to be aware that there is a problem among adults and it is increasing. And so the more we're aware of that, the more we can start working towards getting treatment.
And adults have options. There's individual treatment, group treatment, and even art therapy, which Roberts says can be very helpful with body image.
When you're doing art, you're not thinking about your body. And you're not obsessing about your body. And so learning those mindful skills that can include art, there's other mindful skills to help you when you are feeling like you're obsessing about your weight or you're obsessing about your body, how to distract your mind and use self-calming or mindfulness skills.
Putting the Valley first. Mary Stackhouse, WZDX News.
According to ANAT, of all mental illnesses, eating disorders have the highest mortality rate.
For more information about the individual and group therapy, just head to rocketcitynow.com and click on this story.